to meet you. I see you're a new patient. All right. So what brings you in today? A routine checkup and a cranial nerve exam? All right. Wonderful. And how are you feeling today? A little under the weather? Okay. What seems to be bothering you exactly? Fever? Okay. Earache and sore throat? Okay. My goodness, I am so sorry. Let's see if we can get you taken care of here today. All right, and do you smoke or drink? Good, good. No, wonderful. Let's try and keep it that way. And do you or a family member have any pre-existing medical conditions? Heart disease on your mother's side. Okay. And do you have any allergies to any medications? No? Wonderful. And are you currently taking any medications? No? Okay. And in the last 30 days, have you or anyone you've come in contact with been exposed to measles, mumps, or chickenpox? Not to your knowledge? Okay. And are all of your immunizations up to date? You think you need a tetanus shot? Okay. We can get you taken care of. Absolutely. All right. And it seems as though the nurse didn't take your vitals yet, so I'm going to go ahead and do that for you, okay? First, I'm going to go ahead and listen to your heart. Okay. Now, listen to your chest first. I want you to go ahead and breathe in. Hold it. And breathe out. And again, breathe in. Hold. And breathe out. And one more time. Breathe in. Hold and breathe out. Okay, that sounds good. Let me listen to your back, okay? All right. I want you to breathe in. Hold it, hold it. Breathe out. And again, breathe in. Breathe out. And one more time, breathe in. Breathe out. Okay, your heart sounds great. Wonderful. All right. Right, I'm going to go ahead and get your blood pressure. Go ahead and extend your arm and all right, good job. Let's see. Alrighty. One more time. Alright, 120 over 80. That is perfect. Let's go ahead and take your arm out of that. Thank you. Okay, I know you mentioned you were feeling a bit warm, so I'm going to go ahead and get your temperature. So let me just put this right on your forehead. Alright. Oh, yeah, you are a bit warm. 100.1. It's definitely a little bit warm. All right. It's all right, though. I'll prescribe you some ibuprofen for that. All right. And now I'm going to go ahead and look at your ears with this light, okay? All right. So let's see. Let's look at this ear. All right. And let's look at the other ear. Okay, yeah. All right. Your left ear is a little bit inflamed, a little bit red. Definitely want to get you on some antibiotics or something for that. And let me go ahead and look at this. Look at your throat. I want you to go ahead and say, ah. Okay. Yeah. Yeah, your throat is a little red as well. Okay. So I am going to go ahead and prescribe you some ibuprofen for the fever, so we can get that fever down a little bit. And since your ear infection and your sore throat seem to be bacterial, I'm going to go ahead and get you on some antibiotics. I'm going to recommend amoxicillin since you don't have a penicillin allergy. So we're going to go ahead and do that, and I will get you those prescriptions before you leave here today, okay? The ibuprofen you can get over the counter. You won't need a prescription for that, but you will need a prescription for the amoxicillin, so I will take care of you there. Okay, I'm going to go ahead and test your reflexes, alright? Don't worry, this won't hurt or anything. So can you go ahead and extend your arm for me? Thank you. Okay, good, good. Other arm. Wonderful. Alright. I'm going to get your kneecaps real quick, okay? Okay, excellent. Your reflexes seem to be very good. Alright, nothing to worry about with your reflexes. Everything seems good there. Alright. Okay, now we're going to go ahead and get the tetanus shot out of the way, okay? So I'm going to take and use some gauze pads. Alright. And put some peroxide on it. Okay. Now may I see your arm? Okay, awesome. Gotta make sure it's nice and sterile. Okay. Now this is just gonna sting for just a minute, okay? If you want to, you can look away or you can think of puppies and kitties. It's okay. It'll just be for a second and I promise it'll all be over. Alright, I just need you to be very still. Alright, good job. See, that didn't hurt at all. Alright. Now let me go ahead and clean this up for you. Right. Let's take some gauze here and look, you get a cute band-aid with an octopus on it. Isn't that adorable? Alright. So let me go ahead and get this band-aid out of here. Alright, we're going to go ahead and put that right on your arm. Awesome, awesome. want you to follow the light with your eyes while keeping your head perfectly still, okay? Just follow the light with your eyes. Don't move your head. Okay. Good job. Alright, now I want you to look at my nose. And only look at my nose, and I just want you to tell me if you can see the light out of your peripheral vision. Just keep looking at my nose. Don't take your focus off my nose. Alright, good job. Alright, now I want you to tell me when the light leaves your field of vision, okay? Good. 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 Okay. 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 Alright, good. Now I want you to look at my nose. And same thing, I want you to tell me when the light leaves your field of vision, okay? Good. 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 Excellent. Good. 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 Okay, now I'm just going to take a look at your eyes real quick. Right, I'm just going to look at your pupils here. Okay, and the other eye. Alright, alright. Everything seems to look good there. Okay. Okay, now while looking at the light, I want you to tell me how many fingers I'm holding up, okay? Just look at the light and tell me out of your peripheral vision how many fingers I'm holding up. Good, good. Awesome. We're going to switch hands. Keep your focus on the light. Okay, excellent, excellent. Okay, now I want you to cover one eye, and I want you to tell me how many fingers I'm holding up. Good job. Now go ahead and cover the other eye. Okay, good job. Okay. I want you to tell me if the light gets closer or further away from you, okay? Where's the light now? Closer? Yes. Closer? Mm-hmm. Further away? Mm-hmm. Close? Far? Close? Close? Mm-hmm. Far? Okay. Far? Okay. Close? Mm-hmm. Close? Mm-hmm. Close? Far? Mm-hmm. Far? Mm-hmm. Far? Mm-hmm. Close? 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 Far? Close? Far? Alright, perfect. Okay, now we are going to do the color test. I'm going to show you some objects, and I just want you to tell tell me what color they are, okay? So what color is this? What color is this? Pink? Good job. Okay. What color is this? White? Okay, good job, good job. Good job. All right. And what color is this? White? And what color am I pointing to? Yellow. Good job. And what color is the handle? Red. Yes, red. Okay. Now, what color are these? Yellow. Yellow. And what color is my pen? Black. Good job. Okay, your eyes are looking great, so we're going to go ahead and move on to the hearing portion of the test. So I'm going to present you with 2 sounds, and I want you to go ahead and close your eyes for this test, okay? So I'm going to give you a sound A and a sound B. This is going to be sound A, and this is going to be sound B. And with your eyes closed, I want you to tell me which sound is which, okay? Alright, just for a reminder here, sound A, sound B. Alright, now go ahead and close your eyes. Good. Alright, now tell me which one do you hear, sound A or sound B? Sound B? Good. Sound B? A or B? A, okay. A or B? B, wonderful. A or B? A, okay, good job. A or B? A. A or B? A. A or B? B. A or B? B, good job. A or B? A, wonderful. A or B? A, good job. A or B? B, Alright, good job. Alright, keep your eyes closed. We're going to do one more, okay? Same rules apply, just 2 different sounds. So this will now be sound A, and this will be sound B. Okay? A and B. Alright, ready? A or B? A, wonderful. A or B? B, A or B? B, good job. A or B? A, awesome. A or B? B. A or B? A, A or B? A. A or B? A, good job. A or B? B, A or B? B, A or B? A, excellent. Okay, you can go ahead and open your eyes now. Okay, next, we're going to do another hearing test. And this time I want you to tell me if the sound is closer or further away from you, okay? Is that close? Okay, good. Mm-hmm. Close. Mm-hmm. Close. Mm-hmm. Further away. Mm-hmm. Further away. Excellent. Further away. Mm-hmm. Close. Mm-hmm. Close. Mm-hmm. Mm-hmm. Close. Mm-hmm. Further away. Mm-hmm. Further away. Mm-hmm. Close. Mm-hmm. Further away. Good job. Close. Mm-hmm. Close. Mm-hmm. Further away. Mm-hmm. And close. Yes. Good job. Okay, good job so far. So next I'm going to test your sense of touch with the dull and sharp test, okay? Now I'm just going to touch these objects to your face very lightly, and I want you to tell me if the object is dull or sharp, okay? So this is dull. Alright, and then this is sharp. Okay? Alright, ready? Let's go. Dull or sharp? Dull, good. Dull or sharp? Sharp, Dull or sharp? Sharp, excellent. Dull or sharp? Dull, Dull or sharp? Sharp, Dull or sharp? Dull. Dull or sharp? Sharp, Dull or sharp? Dull, Dull or sharp? Dull, Okay, and dull or sharp? Dull, Dull or sharp? Sharp, Dull or sharp? Dull, Dull or sharp? Sharp, Dull or sharp? Sharp, and dull or sharp? Dull, Dull or sharp? Sharp, and dull or sharp? Dull, excellent. Okay, now I'm going to move on to testing your sense of smell. So I'm going to take a little gauze pad like this, and I'm just going to put some fragrance on it, and I want you to tell me what you smell, okay? Alright, what does this one smell like? Okay, oranges. Good, good job. Alright, next one. And what does this one smell like? Lemons. Alright, next. What does this one smell like? Grapes. Alright, and then this one. Lavender. Good job. Alright. And what does this one smell like? Vanilla. Okay. Good job. Good job. Okay, so now we're going to do the taste test. Alright. So I'm just going to take a few drops of this, and I'm going to put it on your tongue, okay? Alright, what does that taste like? Peppermint? Good job. Alright, next one. Good job. Okay. And this next one. What does that taste like? Oranges? Mm-hmm. All right. And next. What does that taste like? Grapes. Mm-hmm. Wonderful. All right. One more. And what does that taste like? Bubblegum? Mm-hmm. Perfect, perfect. All right. Well, your sense of taste seems to be good. Okay, well, that concludes your routine checkup and your cranial nerve exam. Everything seems to be fine other than that fever and the sore throat and the ear infection, but like I said, I will get you that amoxicillin. So I'm going to go ahead and write that prescription for you. All right. And I recommend that you pick up some ibuprofen to help lower your fever a little bit because you are a bit warm. Also, make sure you get plenty of rest and drink plenty of clear fluids. Definitely increase your water intake and maybe eat some chicken noodle soup. I think you should be feeling a lot better very soon. Also, make sure you take all of your antibiotics. Even if you start feeling better, still take all of them as prescribed twice a day, okay? Even if you're feeling better, I still want you to take your antibiotics, alright? Take them until they are all gone. That way the infection doesn't come back and you don't have to go through this again. So we want you to get better and stay better, okay? Alright. Alright, and I will give your prescription for the amoxicillin with your nurse, and she will get you discharged, and I will see you again in 6 months, okay? Sound good? Alright, wonderful, wonderful. And if you enjoyed your visit today and everything went well, go ahead and like and subscribe and leave a comment. Thank you very much. And I will see you next time.